Men, I'll be direct in the way a physician should be. I hear this every week. Can masturbation transmit HIV? For solo activity, the scientific answer is no, because transmission requires a real doorway. Transmission happens when infectious fluids reach vulnerable mucous membranes or a fresh open cut, eyes, mouth, urethra, rectum, not from intact skin, not from the air, and not from casual touch. According to the CDC's 2025 update, more than 39,000 people were newly diagnosed in 2023, and over 4 out of 5 were men, so getting the facts right protects us. In this video, I'll dismantle the myths, show you which scenarios with hands and fluids are safe versus risky, and give you a calm routine that keeps you protected without shame at any age. If this matters to you, tap subscribe and comment OK. Your voice guides the next evidence-based show. Understand the entry points and fear shrinks fast. If this topic matters, hit subscribe and comment safe and smart. Stay to the end. I'll reveal the #1 mistake men make and the tiny tweak that turns discomfort into confidence. A young man in care for HIV asked me last week, "Doctor, I never had intercourse and never shared items with anyone. So how did this happen?" I sat him down, took a full history, and explained the actual transmission map. HIV is carried in specific fluids: blood, semen, rectal fluid, vaginal fluid, and breast milk. Those fluids must reach vulnerable tissues or the bloodstream to matter. It does not spread through sweat, saliva in ordinary contexts, intact skin, casual touch, surfaces, or air. No handshake, no toilet seat, no gym bench will transmit HIV. Solo masturbation is not a transmission route. There is no partner, and infectious fluid has no realistic path to your mucous membranes or bloodstream. Mutual masturbation with hands is extremely low risk. The concern rises only if infectious semen or blood reaches an entry point such as the eyes, mouth, urethra, rectum, or a fresh open cut. Think of a simple diagram. Fluids on the left, entry points on the right, and arrows connecting only when contact is direct and recent. If there is no arrow, there is no route. Drying, dilution, and soap break down risk quickly outside the body. A prompt wash with soap and water closes the loop for hands and toys. Remember that intact, unbroken skin is an effective barrier that HIV cannot cross under normal conditions. Higher risk belongs to acts where fluids are exchanged directly with mucous membranes or where needles puncture skin. Hands on intact skin are not the same as unprotected intercourse or shared injection equipment. When anxiety spikes, return to the map: fluid, doorway, timing, and condition of the skin. If any piece is missing, transmission is not biologically plausible. Document your scenario, then match it against the map with your clinician. Clarity replaces fear when facts guide the conclusion. Know the doorways so you can close the right ones. Some young men have confessed to me after a scare that masturbation was involved, and they fear they brought this on themselves. I do not judge them. I sit beside them like family, and we review facts with steady, clinical calm. Myth #1. Semen on the hand automatically means infection. Truth: not unless that fluid reaches a real doorway, the eyes, mouth, urethra, rectum, or a fresh open cut, because intact skin is a shield HIV cannot cross under ordinary conditions. Myth #2. Rubbing or touching through healthy, unbroken skin is still dangerous. Truth: no, the virus does not pass through intact skin. Touch, massage, and external handling without mucosal contact do not create a realistic transmission route in clinical practice. Myth #3. Dried semen on skin remains highly infectious for long periods. Truth: infectiousness falls rapidly as fluids dry or are diluted, and ordinary soap and water are enough to disrupt and remove what remains from hands, surfaces, and sex toys. Myth #4. Hand jobs or fingering are inherently risky. Truth, they are generally very low risk unless blood is present or infectious semen finds its way to a mucous membrane or an open wound, which is preventable with simple hygiene and mindful boundaries. If your scenario did not include a doorway, there was no route. Map the event: which fluid, which body part, whether the skin was intact, how soon cleanup happened, and whether there was visible blood, because these specific details decide biology, not the label of the act. When shame is loud, I ask you to trade it for a checklist. Wash with soap and water, trim nails, use lubricant to avoid microtears, cover cuts, and place tissues and towels where cleanup is easy, because preparation turns panic into control and clarity. Remember, risk lives at the destination of fluids, not in the name of the act. Alone. A few days ago, I met several young men with the same anxious question, and I did one simple thing that changed the room. I sat them in a circle, spoke as their physician, and walked through a calm, practical playbook. First, protect the skin you depend on. Use a quality water-based or silicone-based lubricant during solo or mutual touch to prevent microtears. Friction without lube irritates tissue, and irritated tissue invites unnecessary worry. Second, prepare your hands. Trim nails smoothly, file rough edges, and remove rings when possible. Cover fresh cuts with a small bandage. If you have eczema or broken skin, let it heal before any intimate contact. Third, respect surfaces and toys. Avoid abrasive textures that scrape. Choose smooth materials, inspect for cracks, and clean before and after use. Warm water plus plain soap works. Allow items to dry fully between sessions. Fourth, plan the cleanup. Place tissues or a towel within reach. When finished, wipe away fluids, then wash hands and toys with soap and warm water for at least 20 seconds. Do not reuse soiled tissues or towels. Dispose of them promptly. Fifth, set boundaries together. Before anything starts, agree on where fluids will and will not go, especially keeping semen away from eyes, mouth, fresh cuts, or irritated skin. Decide the finish location ahead of time so there are no surprises. Sixth, pace and check in. If someone reports stinging, burning, or bleeding, stop, reassess, and switch to gentler methods. Comfort is a safety signal. Seventh, store wisely. Keep lube, bandages, tissues, and a mild moisturizer in one kit. After washing, apply a light moisturizer if skin feels dry, then give the area a rest day if it was irritated. Finally, remember the mindset. Preparation is not paranoia, it is respect for your body. Comfort plus hygiene equals confidence, not panic. Calm habits become automatic over time, gentlemen. During training, I gave the men several scenarios and asked them to practice mapping risk as a clinician. We looked at what fluid was present, which doorway it reached, how quickly cleanup happened, and whether the skin was intact. Scenario 1. Visible blood from either person. Blood contains the highest viral concentration, and any contact with a fresh cut, puncture, or mucosal surface creates a plausible route that must be taken seriously. Scenario 2. Open wounds, cracked skin, or active eczema. Compromised skin is not the same as intact skin, so cover lesions with a bandage and let them heal before any intimate contact. Scenario 3. Active STIs or inflammation. Urethritis, proctitis, mouth sores, or genital ulcers increase susceptibility because inflamed tissue is easier for pathogens to cross. Scenario 4. Ejaculate reaching the eyes or mouth. If infectious semen splashes into a mucous membrane, rinse immediately with clean water, avoid rubbing, and arrange medical assessment. Scenario 5. Ejaculate on intact skin with immediate washing. This is very low risk. Soap and water are sufficient to remove and deactivate fluid outside the body. Scenario 6. toys with unnoticed cracks. Rough, damaged surfaces can abrade tissue. Inspect before use and replace worn items to protect the barrier you depend on. Use the quick triage: fluid, doorway, timing, and skin condition. If any link is missing, transmission is biologically unlikely. If all links are present, seek medical advice and follow a testing timeline. Build prevention into the routine. Keep lubricant, tissues, bandages, and mild soap within reach. Plan a clear finish location away from eyes, mouth, and any fresh cuts. Agree on boundaries before you begin. Panic is not a plan. Draw the exposure map, act on the facts, and you will recover your composure. If this guidance resonates with you, type "happy" in the comments so I can shape the future lessons to what you truly need. Every day, patients wait to see me because I answer with respect and steady clarity, and they feel seen rather than judged. I hear the same request: "Doctor, please walk with me through the steps. I need guidance, not guesses, and I want a calm, consistent plan across clinics." First, confirm whether there was a real doorway. If infectious fluid did not reach the eyes, mouth, urethra, rectum, or a fresh open cut, routine testing on your schedule is enough, and you can release the emergency stories your mind writes. If a plausible route occurred, we use a 3-point timeline. At 3 to 4 weeks, take a 4th-generation antigen or antibody test. Many early infections register by this point, and a negative result lowers worry. At 6 weeks, repeat the 4th-generation test to add confidence and catch late seroconversion. Pair that visit with a review of symptoms, STI screening if indicated, and a conversation about stress and sleep, because recovery is also behavioral. At 3 months, run a final 4th-generation test. For most guidelines, that window is conclusive in people without complicating conditions, and you can close the file with clinical certainty and return fully to ordinary life. For high-risk, recent exposures, consider an RNA or NAT test in the first 1 to 2 weeks, guided by a clinician. These detect viral genetic material sooner, especially when anxiety is high, and rapid clarity will prevent ruminating and catastrophic decision-making. Between tests, follow the simple playbook: protect skin, use lubricant to avoid microtears, treat inflammation, and avoid routes that would reintroduce risk. Keep your daily routine steady. Sleep, nutrition, and exercise help the nervous system rebalance. Testing is not a threat. It is a calendar for freedom, a sequence that trades worry for verified results, and a way to turn "what if" into "I know." Walk the steps and let the numbers return you to peace. Beyond the scenarios we discussed, many men come to me frightened because symptoms overlap across different conditions. If you were one of them, your panic would be understandable, and my job is to separate signal from noise with a clear plan. Other sexually transmitted infections can occur with sexual contact, even when HIV risk is negligible. Chlamydia and gonorrhea may cause urethral burning or discharge. Syphilis can present with a painless ulcer or rash. Herpes, HSV 1 or 2, creates clusters of tender blisters that crust. Each of these deserves testing and treatment. Inflammation and microtears matter. Irritated tissue is easier to penetrate than calm, intact skin, so prevention focuses on comfort and barrier protection. Use lubricant to reduce friction during solo or mutual touch. Avoid abrasive toys and surfaces. Pause if you notice stinging, bleeding, or chafing. Rest and reassess. Skincare is part of sexual health. Keep nails smooth, cover cuts with small dressings, and allow eczema or dermatitis to heal before intimacy. Wash hands and devices with warm water and soap after use, then dry fully. A light, fragrance-free moisturizer can restore the barrier after washing. If symptoms appear, resist self-diagnosis. Arrange STI screening, including throat or rectal swabs when relevant. Share the timeline of exposures, products used, and any over-the-counter treatments because these details guide accurate care. While waiting for results, act to reduce irritation. Choose breathable underwear, avoid fragranced products, and apply cool compresses. Abstain or limit activity until pain and redness settle. When antibiotics or antivirals are prescribed, take them fully as directed and complete the course. Here is the mindset that protects you. Comfort first, barrier intact, inflammation down. If you keep the skin healthy, you close doors before they open. Calm rituals today prevent anxious nights tomorrow, and they return control to you. Recently, I met a patient, a man unlike my usual cases, and I began the consultation with a simple question about what worried him most. He hesitated, then admitted the fear that his anxiety, guilt, or porn habits meant he might already have HIV. As his physician, I answered plainly. Anxiety is not a symptom of HIV, and neither is guilt. Porn use is a behavior choice, not a biological marker. HIV is identified by exposure routes, tests for antigen, antibody, or viral RNA, and clinical evaluation, not by feelings. He then asked whether frequent masturbation changes test results or delays detection. It does not. Test accuracy depends on time from exposure and lab performance, not on how often you masturbate. What does matter is whether infectious fluids reached a doorway like eyes, mouth, urethra, rectum, or a fresh open cut. If there was no doorway, there is no route. If there was a doorway, we follow the testing timeline and move step by step until the file is closed with evidence. I also address the mental loop that amplifies fear. Compulsive checking, online searching, or repeatedly examining the body for tiny changes turns the nervous system into an alarm bell. That alarm makes neutral sensations feel dangerous. To regain control, build a simple routine. Limit searches to scheduled times, practice slow breathing, and keep a written exposure map listing fluid, doorway, timing, and skin condition. If the map shows no route, return to ordinary life and protect your skin. Choose habits that leave you steady afterward, not ashamed or depleted. Stop when irritation appears, rest, hydrate, and sleep. If porn leaves you anxious, scale it back, change context, or take a structured break. If distress persists, talk to a clinician or counselor. Separate the noise of the mind from the facts of science, and calm will follow. Facts guide choices, confidence returns. This is the method I've taught to hundreds of male patients. It lowers anxiety and protects the skin you rely on for comfort. Step 1. Tidy the scene. Use tissues or a clean towel you placed within reach beforehand. Contain fluids immediately so they do not reach eyes, mouth, fresh cuts, or irritated areas. Step 2. Wash. Go to the sink and wash hands and any toys with warm water and plain soap for at least 20 seconds. Rinse thoroughly and let items dry in open air. Step 3. Scan the skin. Look for stinging, redness, chafing, or any bleeding. If present, stop further activity, note the location, and plan a rest day for that area. Step 4. Moisturize. Apply a thin layer of a fragrance-free, non-comedogenic moisturizer to restore the barrier after washing. Avoid fragranced products, alcohol wipes, or scrubs that can irritate tissue. Step 5. Breathe. Take 6 slow breaths in through the nose and out through the mouth. This signals the nervous system that the event is complete and you are safe. With a partner, add a cleanup agreement. Decide the finish location before you start. Keep fluids away from eyes, mouth, or any open cuts, and bring tissues and soap within reach. Make a simple kit. Include lube, bandages, tissues, a mild cleanser, a small towel, and moisturizer. Store it together so ritual becomes effortless and consistent. Think of this routine as closing the file. It is short, repeatable and based on physiology. Remove fluid, protect the barrier, reduce inflammation, and settle the nerves. If discomfort persists or you notice sores, discharge, or fever, pause sexual activity and arrange clinical testing. Your body is giving you information. Respect it and respond early. 1 minute of thoughtful cleanup delivers a day of calm focus. Make the habit automatic, and your future self will thank you for the peace it provides. If your mind feels lighter right now, you are not alone. Thousands of men needed this clarity before they could breathe again and return to normal life. Type "calm" in the comments if this helped, and add one question you still want answered, so I can shape the next lesson to what you truly need and deliver it with the same careful, stigma-free approach you deserve from your doctor. Share this with a friend who worries in silence at night. Case: a 24-year-old man came to clinic after mutual masturbation with a friend. He reported no ejaculation into eyes or mouth, no oral contact, and no penetrative sex. There was no visible blood, and both men washed promptly with soap and water. On exam, skin was intact without cuts, ulcers, or discharge. I explained that without contact between infectious fluid and a mucous membrane or a fresh open wound, HIV transmission is not biologically plausible. We reviewed a simple plan. Continue routine hygiene, avoid irritation, and test only if a true exposure route ever occurs. For reassurance, he scheduled a 4th-generation test at 6 weeks, then returned to ordinary life. Anxiety fell once facts replaced guesses, and his sleep improved. Thank you for listening with patience and respect. As your physician, I am genuinely grateful, because this attention fuels my purpose and proves that clear, stigma-free guidance changes lives in quiet, practical ways every single day. Here is the big picture in one breath. Solo masturbation does not transmit HIV, and mutual hand contact is low risk unless infectious semen or blood reaches a true doorway like eyes, mouth, urethra, rectum, or a fresh cut. Build decisions on 3 pillars. First, a map tracing fluid to doorway to timing and skin condition. Second, comfort and hygiene habits that keep skin healthy. Third, a testing timeline used when a real route exists. If no exposure pathway occurred, release fear and return to ordinary life while protecting skin with lubricant, gentle materials, trimmed nails, and soap and water. If a real pathway occurred, test on schedule and let evidence settle your mind. Panic fades when you tidy facts. Intact skin blocks the virus, drying and washing reduce risk outside body, and early care for irritation or other STIs lowers inflammation. Closing doors before they open and restoring comfort and control. Use a quick closure ritual after any encounter. Remove fluids, wash thoroughly, scan for irritation or bleeding, moisturize if needed, and breathe slowly until the nervous system settles. 1 thoughtful minute often buys a full day of confidence. If anxiety loops keep replaying, write an exposure map, limit internet searches to scheduled times, ground yourself with sleep and movement, and speak with a clinician or counselor. Mental clarity is care, and your body deserves that peace. Please subscribe and share this with a friend who needs reassurance, and leave 1 question below to guide the next lesson. Your action spreads honest education and protects men who worry in silence tonight out there.